Can I order my prescription early to avoid going out?
I would say no in this case. Don't order it early, because if everyone orders it early, it just creates a backlog, as we've seen in the first couple of weeks of this outbreak, or when this country started taking it seriously. So what I mean by that is there's obviously every business, every pharmacy plans for its workload, and as a result of that, they assess their staffing levels on a day-to-day basis, and what their delivery threshold is going to be like, and load is going to be like. Sorry, and too many prescriptions coming in early or in increased quantities means that the pharmacies are not going to be at a place where they can cope with that workload, on a normal in a normal day-to-day sort of basis. So I would say no, don't order early, because pharmacies are staying open, as you've seen. GP surgeries are staying open as well, so you will get your prescriptions when you order them, and you will have the prescriptions assembled, dispensed, checked by the pharmacy team, and either you can pick it up or deliver it like you would on a normal basis. You are allowed to leave your home for exercise or for shopping and going to your pharmacy to pick up medication. So none of these things have changed, and it also enables pharmacies to be able to order stock in a sort of gradual manner. So what's happened now is, because of the initial surge of prescriptions that were coming through, the wholesalers couldn't cope with the demand from multiple pharmacies ordering, like wholesale stock to sort of furnish their prescriptions. And as a result of that, patients became became panicked. Oh, like, I might not get their medication. I might not get my medication because, look, pharmacies can't get hold of the supplies. But it was artificially created, just like the whole toilet paper issue. Now, if you go to the supermarkets, they're full of, all the aisles are full of toilet roll. But initially, in the first couple of weeks, you went to all the supermarkets, all the toilet rolls aisles were just empty, all the pasta aisles were empty. It's because we artificially created a situation where people were just buying, hoarding, and the sort of deliveries couldn't meet the demand. So we don't want that situation in community pharmacy. People will get their medication. There isn't a shortage of medication in this country, but what there could be, or what has happened in the first few weeks, is that the demand from the wholesalers, the request that the pharmacy is making from the wholesalers, they haven't been able to provide it quick enough, which has then created unnecessary panic that just didn't need to be there. So that's my take on it. You don't.
Yeah, I think it's been exacerbated as well by the GPs trying
Yeah.
to get themselves organised as well. They weren't. I think they were doing this out of being prepared, because they were expecting primary care to become ridiculously busy as well.
Yeah.
Well as secondary care. So the instructions were to be able to get repeat prescriptions done and make sure that everybody's got their provisions of meds.
Yeah.
Uh,
I know, Saghir, that general practice have allowed for a few more working days, for the patients to order a bit earlier. But what I mean
yeah,
by early is just like, normally I think it's around about 5 working days that they're
yeah,
allowed to order early, but now they've allowed for 7 working days, as an example, just so that the pharmacy have enough time to order the stock in and get it all ready. But I
yeah,
wouldn't order, like, 3 weeks early or 2 weeks early. It doesn't make sense. You
yeah.
are going to get your medication. Your pharmacy is not closing down. GP surgery is not closing down. You will get your medication, and the wholesalers are all open as well. We're getting our daily deliveries in, so this shouldn't really be an issue.
Yeah, but what we're also seeing is, because the prescriptions have been done early, so the customer expects or has been told that the prescription would be arriving at the pharmacy a bit sooner.
Mm.
Then that backlog, what we've seen is, over the past month in some pharmacies, there's been an increase of anything between 20 to 40% in dispensing activity.
Yeah.
You have that amount of work. What you also have is, you've got X number of staff, but you've got in pretty much every pharmacy that we have, there's at least one person who has to be off because either they're displaying symptoms of COVID-19 or they've got family members in their house who are displaying COVID-19 symptoms. So you could be one person down.
Yeah.
And what we've also experienced is the amount of phone calls that you get. So you pretty much take one member of staff out because all they're doing is responding to the phone.
Mm.
Then the other measures we've had to put in place in regards to social distancing and keeping that 2 meter distance between each of us. We only allow one person or one customer to come into the pharmacy at one time.
Yeah.
So then again, you've got one person on the counter who's pretty much opening and closing the door and allowing that person to come in. So you create this line of customers who need to come into the pharmacy, and it slows things down. But you've already taken out a few members of your team to be able to get the dispensing work. So the dispensing work has also increased quite significantly. But you're putting more stresses and strain on the existing pharmacist and their staff to be able to process everything as well. So that also exacerbates everything being a bit slower than what the customer really needs it to be.
Yeah, definitely. And I think we've got to give props to all the community pharmacy teams out there who have been coming in early and staying behind late and staying open, well, not open on the weekends, but coming in behind closed doors on the weekend with the pharmacists to catch up on the work, to make sure patients are getting in their medication. And they've been doing this out of, their own goodwill, really.
They've been amazing. This has been the toughest period that I've ever experienced in my career, in my 17 years as a pharmacist. And but what I've also seen is I've seen people who are generally scared and worried about their own health and well-being, about coming into the pharmacy and being exposed to so many people, because we have had people coming in coughing and scared that they might have COVID-19 symptoms, even though if you do, you're supposed to isolate straight away. But because of anxiety, you're looking for some help. You're looking for a healthcare professional just to be able to give you some advice. And we've had to send them home, close the pharmacy, deep clean the place before we can allow other customers to come in. And we've got staff who are generally scared about their own health and well-being.
Yeah.
But I have seen a level of dedication that has been quite outstanding by these guys to come in day in, day out, to come in early, to leave late, to come in on their days off, just to be able to get the work done, because they have took it upon their own responsibility to be able to do whatever they can to be there, to be that piece of cog in the whole healthcare apparatus.
Yeah.
So I know there's a lot of things that the general public don't necessarily see, and which is fair enough. How can they notice that? But these guys have gone above and beyond for the patients and communities that they serve, just to be able to say that, okay, our job here is to make sure that we're getting the necessary medication out to those patients, and there's no delay, because the last thing we want is to be delays to provision of meds, and that person's condition to worsen, or you've got patients who are more at risk of getting COVID-19, and the repercussions of them getting it are much greater than others. And we don't want those people to suffer. So I know there's been greater appreciation of the general public of what pharmacists and the pharmacy techs and the teams are doing. But I really do hope that during this period of time and beyond, people have a greater appreciation of what their pharmacies do. And it's not just about providing medication to the general public, it's providing that information on how to get the best out of the meds. It's about information on public health, which I know both of us believe that pharmacy could do a heck of a lot more if supported by NHS England and the area teams. But truth be told, they have been fantastic during this period.
Yeah, definitely. I mean, even I know pharmacists that have been doing deliveries themselves, and it's not in their job spec. They've been
Yeah.
behind and doing deliveries. And I know that from the surgery where I work,
Yeah.
one of the reception staff, um, she lives next to one of the Iman pharmacies, Cathedral.
Yeah.
And she says that she's seen Nabil around about 7, 8 o'clock in his van, dropping off medication, and the pharmacy closes at 6.
Yeah.
And he's staying behind and doing this, going out of his way. We have cases like Salwan in Leeds at the pharmacy on Hare Hill Road, and Zoeb in Brockwood, doing handing out sanitizing gel, making kits free of charge for their patients, and this is all out of the goodwill of the individual pharmacy managers and their
Yeah.
teams doing this. Many
It
people have,
also just shows how important it really is. You put the community back into community pharmacy. That wherever you have a community of people, there's always a community pharmacy there, and it shouldn't just be about you know where you get your meds from. It's how that pharmacy integrates itself into that community,
yeah. Uh,
and has more than just meds.
Yeah, and some pharmacies have been referral points where they're linked in with some local charities that are
Yeah.
doing sort of deliveries for vulnerable patients that don't that may have lost their income, lost that are struggling financially, so they need help with shopping. So a lot of pharmacies have been doing that.